A very good evening and welcome to this week's episode of our national election debate. We're coming to you live from Bloemfontein. And tonight this series is brought to you by SABC News in partnership with the Universities of the Free State and Johannesburg. Now, before we ask our panelists as to who exactly among them has the best health policy as we go into the May 7 election, let's hear this little insert that prepares us for this debate, prepared by Linda Mgobozi from our Durban office.
In his inaugural State of the Nation address, the late former President Nelson Mandela announced a wide-ranging reforms in public health. These included free health care to all pregnant mothers and children under the age of 6. These were followed by many accomplishments, such as choice on the termination of pregnancy, anti-tobacco legislation, improvement on immunization programs and malaria control, and hospital revitalization and clinic expansions. 18 new hospitals have been built and 700 new clinics.
There was a white paper on the health reform that was drafted at that time, and which was promising to deliver the level of health care at primary health care at the district level, and many of those things over time began to show results.
But these accomplishments were eroded by the rapid spread of HIV infections. The disease was young and killing people in millions, a catastrophic period for scientists and medical doctors.
Whenever you came across patients that had HIV/AIDS, you sort of felt like you felt helpless.
As South Africa led the world with the highest number of HIV-infected people, a blame war broke out between government and some NGOs who were demanding access to AIDS drugs. This war ended up in courts.
It's not a part that we are very proud of. Any disease model, you probably have to be guided by scientists.
By 2009, the disease was 28 years old. Billions of dollars had been invested into research. A trial conducted in KwaZulu-Natal by a team of scientists was the first to show that topical gel tenofovir could reduce transmission of HIV. While countries like India have managed to produce affordable drugs, and South Africa was able to turn the corner. Annual new infections and deaths have gone down by over a third. During this period, TB re-emerged and became the biggest killer of HIV-positive people. Many of those who defaulted on treatment developed a multi-drug resistant TB and X3R, most found in KwaZulu-Natal.
Thank you to our Minister, Dr. Aaron Tsaledi, who in 2012 came to our province to actually launch on behalf of the whole country the new machine called the Gene Expert machine. The results are going to say this is ordinary TB, this is MTR TB, this is XTR TB, and you go home already with the appropriate treatment.
Democracy in 1994 also meant people were now free to ply their trade elsewhere. This affected the public health sector. It saw an exodus of trained medical staff like nurses and doctors to countries like the United Kingdom. Negligence and non-compliance to basic hygiene led to outbreaks like Klebsiella that killed over 20 babies at Mahatma Gandhi Memorial Hospital in Durban. The shortage of medical equipment, drugs and poor running of public hospitals was reported across the country. This led to the Ministry of Health announcing that all hospital CEOs must be people with the health background, and the National Health Insurance has been introduced. There are 10 pilot districts countrywide.
We have begun to contract GPs, general practitioners, to go and work in the clinics, to stop patients coming into hospitals and see patients that otherwise can be seen at the clinic, at the level of a clinic.
The war on low drug pricing is still on between government and pharmaceutical companies. The last 20 years have been a long journey for the South African public health. It has been a journey of darkness and hopelessness, a journey of exciting discoveries that could lead to a successful health system. Linda Mgobozi, SABC News, Durban.
That insert prepared for us by Linda Mkobozi. Well, let's go to our panelists. Representing the African National Congress is Dr. Aaron Motsoaledi. In 1 minute, Dr. Motsoaledi, your party's opening statements on the state of our national health.
Well, Vuyo, firstly, you are aware that before 1994, South Africa had 14 different departments of health, divided racially and tribally, with one system favoring the minority who are whites with lots of resources, and one system specifically for black people, especially Africans, which was very under-resourced. After the elections, we amalgamated them into one. Secondly, we opened access. 40% of the health facilities that exist in the country were built after Utata Nelson Mandela became president of this country. In 2009, we moved a gear further. We said 4 things must happen. 1, increase life expectancy. 2, deal with maternal and child mortality. 3, deal with the scourge of HIV, AIDS, TB, and malaria. We have done those. And 4, increase the efficiency and effectiveness of the healthcare system. That is the challenge that we are faced with. And all our programs are about resolving that one. But the first 3 we have achieved.
Dr. Aaron Motsoaledi, well, thank you very much. Let's hear what the Democratic Alliance has to say in their opening remarks about tonight's topic. Ms. Patricia Kopane is the DA's provincial premier candidate.
Okay. Thank you, Vuyo. Firstly, the Democratic Alliance, we are the only official opposition party that we're in government. We govern in the Western Cape, so our policies are tested. And the Democratic Alliance, we believe that the caring government must always ensure that there is accessible, affordable, and the quality health care that's supposed to be provided to all South African citizens, irrespective of their background or their financial circumstances. And secondly, South Africa remains the second worst country in the world in terms of the tuberculosis. And 144 out of 148 in terms of HIV/AIDS, and 107 out of 148 in terms of child mortality rate, and 136 out of 148 countries in terms of the life expectancy. And the Democratic Alliance, we also understand that the essence of South African health challenges, it is because of the mismanagement and the poor use of the scarce resources, and also the failure of the political accountability.
Thank you very much. That's Ms. Patricia Kopane from the Democratic Alliance. We move on now to Mr. Papi Khanare from the Congress of the People. Your opening statement, sir.
My opening statement is quite simple. The people of South Africa hear something and they experience something else. We talk about quality health care, but we are the only country where people wake up at 4 o'clock to go to the hospital or a clinic, which usually opens at 8, without any guarantee that they will get the medicine by the time they leave there. As COPE, we promise the people of South Africa that we will make sure that poor financial management is taken care of, that there will be the leadership and management at hospitals and clinics will be people who are capable and professional, that we'll have a long-term human resource development strategy and plan to address shortages, which are, after 20 years, we are not supposed to be talking about.
Thank you very much, Mr. Papi Khanare from the Congress of the People. Let's hear now some opening statements from Mr. Wouter Wessels from the Freedom Front Plus.
Thank you. Well, I think we must be realistic. What are the facts out there? The people in South Africa is being failed by the public healthcare system. Public healthcare is not functioning. And we cannot blame apartheid for hospitals not being able to pay their electricity bills. Hospitals being without water. Hospital without electricity is a graveyard. And the minister must tell us why that is happening. Corruption is failing the public healthcare system. We are in the Free State tonight. In the Free State, tenders are awarded to ambulance services, but they only become EMS after they are awarded the tender. They've never been an ambulance service company. We don't have trauma units in the Free State functioning because we are awarding tenders based on friends and based on all kinds of things, we are failing the people. People are dying. We have the lowest life expectancy of all the BRICS countries. The government has failed in 20 years. They will continue to fail. We need change.
Thank you very much. That's Mr. Wouter Wessels from the Freedom Front Plus. Now let's hear from our partners this evening, the University of the Free State. Professor Van Zyl, what for you are the ultimate matrix of a good national healthcare system? Having listened to what these parties have to say, do you think they have their finger on the pulse, so to speak?
Well, yes, thank you for the opportunity. I think, firstly, I just need to say one thing that the Minister missed, which is also an important factor on the last 20 years, is moving from a hospital-centered service to a primary healthcare-centered service, which I think is important. I also think the matrix for firstly measuring ourselves is set by international standards, and that is the Millennium Development Goals, and I think we need to measure ourselves according to that. We need to acknowledge ourselves that we are the country with HIV that has hit us with the largest group of HIV-positive patients in the world. That has got an impact on that. The matrix needs to take that into consideration. I think also the efficiency and effectiveness is important, because that means how we use our resources and also how we will deal with the money available. From our side, we would like to see that we address the Millennium Development Goals and that we progress and have innovations to deal with health for all.
Thank you very much. Professor Van Zyl is from the University of the Free State. We're going to take a quick commercial break. After the break, we'll delve a little bit deeper into the issues raised by our panelists. So stay right where you are.
Designed to celebrate 20 years of freedom and the next generation of dreamers.
When a man's an empty kettle, he should be on his mettle, and yet I'm torn apart just because I'm
Welcome back, and if you've just joined us, whether it's on SAFM, SABC 1, Channel 404, or SABC News Online, this is a live debate. We're coming to you from the University of the Free State, and tonight's debate is, of course, being brought to you by SABC News in partnership with the University of the Free State, but also the University of Johannesburg. Now, this debate is about the state of health services in our country, and we're asking which of the four parties that we have here this evening has the best health policy. Now, if I may come back to you, Dr. Motsoaledi, if I hear the other parties correctly, if I heard them correctly in their opening remarks, no one is arguing with you about opening access, about everything that you've done as the ANC over the past 20 years or over the past 5 years in particular. But they are saying, it would seem to me, that all of that is meaningless if, for example, there are spectacular failures in the area of shortages, critical shortages of medicines. If there are spectacular failures in the areas of hospitals with no X-ray machines, no electricity, no running water in certain instances, stolen medicines, all the things that, in fact, some of the NGOs that are playing in this space have actually highlighted, among them Stop Stockouts, as well as the Eastern Cape Health Crisis Action Coalition.
Vio, if the problems we have mentioned, we acknowledge them. And that's why we have got plans to solve them. But if they were spectacular, as you are claiming, there would not have been results. You can't have spectacular failures in a country and reduce life expectancy, reduce high maternal mortality, reduce infant mortality, run the biggest HIV/AIDS program in the whole world. The program we are running now for HIV and AIDS is the biggest in the world. And so says United Nations, World Health Organization, UNAIDS. You can't call those spectacular failures. The problem, let me take these problems one by one. We had a problem of drug stock out, yes, in isolated number of clinics. Because you are running the biggest program in the whole world. It's not that the drugs were not there in the country, it's logistics. And they said it's a national crisis. I said no. It will become the national crisis the day we lose our 10% buffer stock. What do I mean? We have got 10% buffer stock for drugs in this country. There is a company that is keeping that stock. If there is a crisis, it will be when that buffer stock has been released and there is nothing. So because we are having results in the healthcare system, you can't say the problems we are experiencing are spectacular. They do happen. For instance, when you talk about problems of electricity, you'll quote what has happened at Chris Hani Baragwanath Hospital. We acknowledge those, and we are putting on solutions for all those problems.
Yeah. Dr. Motsoaledi from the ANC. Ms. Patricia Kopane, the problems are not spectacular. Yes, they are being acknowledged, and in fact, everything is being done to resolve them. To you, by Dr. Motsoaledi's story.
Not at all. Firstly, we need to realize that as a country, we are spending 8.7% of our GDP, which means the finance is not a problem. The problem is the provinces that are failing to help us. The provinces, they are failing actually to help the minister. The minister has to try his level best, but the reality is that on daily basis, many hospitals, they are failing this crisis. Presently in the Free State, there are about 3 hospitals in Malutia-Pofu that are failing to pay the service providers 3.3 million for the electricity. Here in the Free State, I've done oversight to the National Hospital where the infrastructure is failing, the roof is leaking, the X-ray department, they've lost expensive machines. That is the problem that we're facing. Already there is also an indication that the vacancy rate is high. The national vacancy rate of doctors, it is 56%. Nursing is 46%. So how do we expect this private healthcare, our public healthcare system to render quality services? There is a study that is out from the University of Wits indicating that most of our nurses and the healthcare practitioners, they are overworked and they are prone to make mistakes. That is why our provincial governments, they are having so many litigation. For example, Gauteng is saving about 3 billion.
I'm going to ask you to hold your thoughts right there. Go to Dr. Motsoaledi very briefly. You're doing very well personally. Thank you very much. However, whatever you are doing is being drowned by all these other failures we are seeing that she has alluded to.
No, as you're listening, she's mentioning isolated failures that happened, maybe there in the Free State, maybe there, and she's making terrible mistakes. Vuyo, this is very important. She says South Africa is spending 8.5% on GDP. There shouldn't be a problem. There is. There is because of inequality, which ANC has put on the table that we want to resolve in the second phase of democracy. Yes, South Africa is spending 8.5% of the GDP on health, but 5% goes to only 16% of the population. The rich, and mostly who are white, they are the ones who are spending most of this money. 84% of the population have to do with only 3.5% of the GDP. That's why I want to introduce the national health insurance, because it's an equalizer between the rich and the poor. And you know the DA. You know that the DA rejects national health insurance because it will expose these inequalities. It's an equalizer between the rich and the poor. So when you talk about the GDP, you must actually not make this type of terrible mistakes.
Thank you very much. Mr. Voter Vessel.
Can I answer?
Mr. Voter Vessel from the Freedom Front Plus, you're shaking your head there.
It's not an equalizer. NHI will fail South Africa more than the primary healthcare system is currently failing. What will NHI do? It will absolutely destroy the infrastructure we currently have. You cannot use NHI, and that's internationally proven. You cannot use NHI to better the infrastructure. No, Minister,
the rich and the poor.
Can I answer
you
that?
are. It's typical. It's
Okay,
typical.
Minister,
No,
let's say him finish.
It's typical that when the ANC is in trouble, when government is in trouble, they start with this electioneering talk. Let's go to the facts. Let's go and look at what we need in South Africa. We need a partnership between medical funds and the private sector, which are essential partners to establish an successful and quality healthcare system in South Africa.
Dr.
I think I need to
Vuyo,
respond.
You're going about it the wrong way,
let's
he said.
understand which world he's living in. The person who said NHI is the equalizer between the rich and the poor.
It's not.
Is Dr. Margaret Chan, the Director General of the World Health Organization.
Why
That
is it
the one
failing
who
in
said
Britain?
so.
Why is
He
it
said
failing
it
in
will
the
be an
USA?
equalizer, universal health
It
coverage.
fails in developed
That
countries.
is why, my brother,
It will fail much more in a
this
developing
system,
country.
you are wasting
Understand?
your time. This system is going to United Nations this year.
And it's not going to
be a
work.
world program.
The people are going to
Okay,
die.
gentlemen,
The people are
let's
going
hold
to
it right
die.
there.
You
Gentlemen,
are
let's-
failing South
I think
Africa.
Let's hear
No,
Mr. Let's
the
hear
J
Mr.
is
Papi
being
Khanare.
attacked
Mr.
here.
Papi Khanare.
I need
Mr.
to
Papi
respond
Khanare.
to that.
Minister, you see, when people say there's no spectacular failure, we understand where you come from. But to a person who goes to a hospital, or the hospitals where there's no running water, where there's shortage of basic consumables, in Chioma Clinic where children cannot be immunized because there's no medicine, to them is spectacular failure.
Yes.
From you, as a minister of ANC, there's no, when our people suffer, it doesn't matter. It doesn't matter. I'm raising this thing.
When you say a country has spectacularly failed, you look at the results.
Go and look
No,
at
I am talking about the overall results.
No,
Yes.
I look at the experience of our people.
Yes.
It's not only.
for
It's
people.
not only. I look at the experience
for
of our
people.
people on daily basis.
Okay,
I'm not
gentlemen,
looking at what
I'm
you are
gonna-
looking
Okay, I'm
at.
going to ask you all to hold your thoughts right there. This debate continues after this short ad break. Don't go away. Are they? Because that screen is empty. I don't know if it's connected, but I haven't been seeing anything there. No, nothing. Okay. Welcome back, and if you just joined us, you are watching and listening to a live debate on the state of our health. And here to debate are the four parties that are telling us what it is that they have in store for us. And these are the parties that will be contesting the national election on May 7. Professor Van Zyl, you are the Dean of the Department of Health Sciences here in the Free State. You've listened to what these parties have to say, to what Dr. Motsoaledi is saying they have done as the ANC in the past 20 years, but also to these other parties about what it is that they still find problematic with, or shall we say catastrophic, as other parties are calling it, with our national health system. From where you sit, what are the challenges?
Firstly, we need to recognize what everybody is saying, and I don't think we differ from that. The inequalities between rich and poor, the impact of poverty on health as large. For us to address these issues, I think we need to start with a vision where we are going with our health. Now, I haven't heard anything else as a counter argument towards a national health insurance. My view would be that the national health insurance needs to be sorted out. We need to actually create a package, minimum package, what we will include in a national health insurance, and deal with the funding and costing of that model, and then deal with everything outside national health insurance package.
Are you saying that you do not have a problem with the NHI per se?
I don't have a problem with the NHI as person.
Thank you very much. Mr. Wouter Wessels, professor here, who in his department they have done so much work on this subject, they don't find anything particularly problematic with the NHI, which Dr. Motsoaledi prescribes as the solution to many, if not most, of our problems.
The problem is there, that we cannot see national health insurance as the solution.
Why not?
We must first, there's prerequisites internationally for establishing NHI. If you go and look at the research that has been done, one of it is exactly the opposite of what the minister is saying. You need to first decrease the gap between rich and poor for NHI to work. You cannot decrease the gap by NHI. You cannot better the public health sector infrastructure with NHI. You cannot do that.
How can you do it?
You can do it by, firstly, sound financial management in provincial departments. What's happening in our provincial departments? NHI is not going to solve the corruption, the amount of bad finance management, the fact that we cannot have clean audit reports of health sector systems. That is unacceptable. That is killing people.
Dr. Mtsoaledi?
Vuyo, the concept of NHI with the World Health Organization called universal health coverage has been checked by experts all over the world. The professor here says we must have a vision. That vision is there. All these political parties who are here are in parliament. They have adopted the National Development Plan.
But
They have, right?
And tell us what package.
Yes.
Tell us the package.
The National
Answer the
Development
question about a
Plan
package.
clearly says an NHI needs to be implemented in phases, supplemented by relative dropping of cost of private health care, supported by good human resources. That is in the
With what
NDP,
What
which
PNB?
is the vision for South Africa adopted by all
What
political
PNB?
parties. You can't pick and choose.
What will the PNB
That
be?
is there already.
Tell us.
From the party I come from, the ANC, if you look at the Freedom Charter in 1955, they mention two things under health. There shall be housing, security, and comfort. They say two things. That a preventative healthcare system must be run by the state, which you are busy implementing. Secondly, that free hospitalization and medical care shall be implemented with special emphasis on children and women. This is what NHI is all about.
What about the prevalence of TB? That's not
Kanare from the Congress of the People.
Let me clarify the situation. All of us has adopted the NDP. COPE support the universal health care.
It's universal health coverage.
Yeah, we support.
Universal health coverage.
No, I said COPE support universal health care. He can't decide what COPE should support.
It is universal health coverage.
That's what I said. I said we support. But the problem here of the NHI, in terms of the minister's own statement, that it is very slow. It is being implemented very slowly, and in Eastern Cape, is absolutely upset. But the issue here is that how you utilize the funds we have, because the NHI is more like a financing model than the actual implementation of healthcare. The issue here is that if you look at the amount of money we spend on consultants in all provinces.
In health.
Yeah, in health.
Yes.
In health.
Yes.
I've got figures here. I've got figures here. I've got figures here.
Yes, Dr. Mtsoaledi.
Never.
An example of the Free State.
No.
On consultants, in 2008, 2009, they spent 344 million.
Yes.
In 2009, 2010, they spent 456 million.
We corrected.
In 2010, 2011, they spent 423
No,
million.
We correct you, Mr. Kanare
No.
from COPE. Dr.
No,
Mtsoaledi
in
to answer
Mpumalanga,
specifically.
I can mention all provinces. I can mention all provinces. I can mention all provinces.
I'll give you the Auditor General's report and show you. In health, particularly at national level, we don't utilize consultants. We corrected the audit.
provincial.
When you give money,
I'm quoting Auditor General.
Yes, Dr. Continue, Dr. Mtsoaledi.
when you give money to certain agencies, which must do certain things for health, including NGOs, etc., which happens a lot in HIV/AIDS, they had classified that as consultant. That is wrong. We have got many partners like Right to Care and many others who are doing HIV counseling and testing. It's not done by us. We pay them and they call those consultants.
No. Let's tell the minister.
Let's hear from the Democratic
tell the
Alliance.
minister
Let's hear from the
Vuyo,
Democratic Alliance.
Firstly, I just wanted to rectify the minister here. The Democratic Alliance, we support the underlying principle of the universal coverage.
Where
That
do
is
we
what, yes. And what we differ, we want to know how are we going to fund this expensive model. The government admitted in the National Development Plan that the NHI is not going to solve the problem of the quality of our healthcare system. Yes. They admitted. And secondly, it clearly says that the NHI is going to be a centralized management, like presently we're having, because it shows where there's a centralized management, bottom to down approach, there is a lack of leadership, there's a lack of accountability. So exactly, that is the problem where we differ.
Vuyo.
Dr. Mutsaledi.
Vuyo.
Quality.
Vuyo, we are bringing NHI, and we are going to release the white paper. That will show exactly how we are going to deal with quality. These people here are speaking about their own version of NHI, not the one we are going to implement. And they can't blame us for that. They can't blame us.
Yes, continue, Dr. Mutsaledi.
No.
They can't blame us for what they have in mind. They can only blame us for what we put on the table. The NHI they are talking about is not ours, it's theirs.
But
that's why.
But do you blame them,
NDP.
Dr. Mutsaledi?
For what?
Do you blame them if you haven't put it forward? In other words, if you haven't given them something to criticize at least.
No, it's because, Vuyo, the first time people came across NHI in this country was when it was brought by those who were criticizing us, not us. We have got our clear model and version of NHI, and we'll put it on the table and on the National Development Plan. They said it's the only solution of South Africa's health problems.
Okay.
Yes.
I'm going to ask you to hold your thoughts. I'm going to ask all of you to hold your thoughts right there.
So.
We have to take a quick commercial break. We'll be back right after this. Yes. Okay. Welcome back. We are coming to you live from the University of the Free State here in Bloemfontein. This is a live debate about the state of our national health. Now, let's go to some of your tweets that you've sent through. Edward Mutibedi says, healthcare is very poor here at Ratlow local municipality. The village of 2,500 people, but there is no clinic here, people. Amanda Jane Wild says, looking forward to it, much to be done if we are to achieve universal care of an adequate standard. Ida Mushi says, it is a disaster. Why do HIV positive patients have different color files in all government clinics? Is it to expose them? Some of the tweets we are seeing there. Well, let me read some of the SMSs that have come through as well. Let's stop blaming the apartheid government, because all the hospitals we have are the ones that were built by the apartheid government and another. As a card-carrying member of the ANC, incompetence and lack of accountability nullify the good work unselfish comrades strive to do. That's KMF in Johannesburg. I totally agree with Dr. Mutsoaledi. Lots is being done, and we need to continue voting ANC to defend those gains made, says another SMS. Well, you can keep those coming, your emails, elections@sabc.co.za, or you can SMS 33726, begin with the message, the word vote, and SMSs cost R1.50. This debate, of course, continues. Let me ask the political parties now to pose some questions or make some comments. I'm going to start with the ANC. Very brief comment or question.
My name is Mxolisi from ANC. I want to ask a question to Dr. Mtsoaledi. Doctor, when are you going to launch the NHI, and how are you going to roll it out? Thank you.
Thank you very much. That's a question from the ANC. Let's hear a question from the Democratic Alliance. Dr. Mtsoaledi, you've noted the question.
Thank you, Vuyo. My name is Kabelo Moreng. I would like to ask Mekopane, because in Bloemfontein, at the psychiatric complex, a patient was raped by a security personnel. Many other cases of such violences has been reported recently. So my question is, with the DA in government, what will they do to protect the safety of patients and medical personnel in the public hospitals? Thank you.
Thank you very much. Let's hear a question from the Congress of the People.
Thank you, Vuyo. My name is Funiwe Petlo from Congress of the People. My question is directed to Dr. Mutsoaledi. Public health institutions in Bloemfontein area did not have medication available for patients, even though there were stacks of expired medication at the City Hall. How was this possible? If you plan to rectify the situation, don't you think it's a bit too late, because some of the patients might have passed on right now? Thank you.
So he has noted that question. Let's get a question from the FF Plus. Quicker.
Thank you so much. My question will be directed to Wouter Wessels, which is our spokesperson on health. How does the FF Plus see the problems with provincial departments of health? How do you propose we solve these problems and improve the state of health and the lack of medicine that we currently experience in state hospitals?
Thank you very much. Dr. Mutsoaledi, you want to start?
Yes, there were two questions for me.
Yes.
The first one is, when are we going to roll out NHI? We've already selected 11 pilot districts for NHI, and we are doing 5 things in those pilot districts. Firstly, we are looking at infrastructure. I've shown them in Parliament, some of these members here, because it's election, they won't acknowledge that. I've shown them the plans on infrastructure. We've sent engineers out for the past 18 months. In each of the 11 pilot districts, they visited each and every clinic and hospital to check what the infrastructure looks like. We have got the results, which is color-coded, and a plan, how we are going to do that in the pilot. We are looking at HR. We are using the new system called WISEN. We have already completed all the clinics in the country. WISEN is work indicators for staffing norms. We are doing that. We have established the Office of Health Standard Compliance to inspect clinics and hospitals for most of the problems they are mentioning. We are re-engineering the primary health care system. And we have already seen when we launched the vaccine, human papilloma virus vaccine, to stop cancer of the cervix of the uterus. We have launched the subdermal implant to stop the issues of unwanted and teenage pregnancies. So these programs are already there, they are going on. The issue about copes for expired medicine. Yes, we acknowledge that in the whole country, in all 9 provinces, we've discovered that medicine expires in depots. That's why here in Mangaung, the ANC took a resolution that we are doing away with the depot system. Hospitals must order directly the drugs from the pharmaceutical companies, and we are busy implementing that program.
Thank you very much. Mekopane.
Thank you, Vuyo. Thanks for the question. As the Democratic Alliance, the most critical things that we normally do where we govern, we make sure that the safety of our patients and the safety of our staff is so paramount. What we normally do, we'll make sure that we employ the security company that has been well accredited and the training is so effective. And secondly, we'll make sure that the vetting is done, because presently in the Free State, the companies that have been employed, vetting was never done. The people who rape our patients, they are still facing criminal charges. So vetting is the key thing that we'll do. And secondly, we'll make sure that we put the resources to our security company people. There need to be the screening machines from the entrance of the hospital to detect any harmful object. We are going to provide them even with the vest, the protective vest, so that they can protect themselves also.
Thank you very much, Mekopane from the Democratic Alliance. Mr. Wouter Wessels, very briefly, we're running out of time in the segment.
Thank you, Vuyo. Thank you for the question. I think it's a problem that's a symptom of a failing government. And we need to go and look at provincial governments. What is happening there? You don't have supply chain management in the Department of Health, for instance, in the Free State. We don't have audits. We don't have stock taking. There's a collapse of the whole financial system. So what we will do is bring back sound financial management, firstly. Go and look at what is the problems. Preventative medicine is very important, but it is failing. We still have 808 prevalence of TB per 100,000 of the population. We still have a too high infant mortality rate. We must, with our new medical technology, with our new advances in medical science, it is unacceptable to have such a high infant mortality rate and maternal mortality rate.
Mr. Wouter Wessels is from the Freedom Front Plus. Time to take another quick ad break. We'll be back right after this. If we have 3 minutes, then we can't. You get me, Lucia? Yeah, I'm saying we can't. We really can't. I mean, we've got 5 panelists. Sorry. Welcome back to this final part of our national election debate on health. Well, we've run out of time, unfortunately. I'm going to give each party literally 20 seconds to wrap up. Tell us why people out there should still vote for you and that you have the best health plan for this country. Mr. Wessels, you want to start?
Thank you, Vuyo. What we need is, what we must acknowledge is that corruption is enhancing inequality in South Africa. We need to eradicate corruption. We need to instill sound financial management. We need to start with primary health care, enhancing infrastructure, making mobile clinics available, and the only way to do that is to really stop with tender fraud, stop with corruption, and instilling better governance.
Thank you very much, Ms. Khanare from the Congress of the People.
We believe that South Africans deserve a better government. A government which will not spend billions of rand on consultants whilst they have employed people. We believe that access to health care should be key to South African people. And lastly, the ANC must stop rewriting history. They know as much as I know that the rollout of the ARVs was as a result of court cases by TAC, which they don't acknowledge today.
Thank you very much. Mekopane, very briefly.
The Democratic Alliance will make sure that the vacancy rates will bring it down. Presently, we're the only government where we managed to reduce the vacancy rates from 30% in nurses to 1%. And secondly, we'll make sure that the private sector will work with the public sector to make sure that we improve the quality of healthcare. And we'll also make sure that we focus on the management, because if the management is not well-trained, well-capacitated, we won't be able to provide the quality healthcare system to our people.
Vuyo, just one advice to Freedom Front. They must go to look for a planet where they will settle. Because he has just said preventative health care doesn't work. The heartbeat of NHI is going to be preventative health care. With prevention of mother-to-child transmission, we've been able to reduce the number of children who are born HIV positive. That's preventative. The last thing,
very briefly, Dr.
We are the only party which has got a plan here, Vision 2030 and NHI. I've been listening to plans here. I can't hear anything.
Thank you very much.
Except criticism.
Professor Van Zyl, very briefly, your closing comments.
Yes, thank you very much. Can I just say,
very briefly,
if you are sick, nobody asks you what you vote. And I think we need to stand together collectively to work out, because from a university side, we also need to plan how to provide human resources to actually service our healthcare.
Thank you. Thank you very much, Professor Van Zyl from the University of the Free State, our partners for this evening. Well, that's where we're going to end it. Who impressed you the most? You decide. Come May 7th. Thank you very much for watching. See you again next week.